So welcome to another edition of the Young Seminars that we have with our host action. This time we have invited Lauryna Aukštikalnė from the, she's a medical doctor and senior clinical pharmacologist resident at the Lithuanian University, Health Science and the Hospital Kaunas clinics. And she's very interested in drug reactions on suspected DILI patients. Her research is based at the Lithuanian University also, of Health Science at the Physiology and Pharmacology Institute, where she's also doing some stem cell research. So Lauryna, I think she stayed sometime, she performed a short-term scientific mission in Malaga, and she's going to tell us a little bit about this experience and how she enjoyed it. So go ahead, Lauryna.
Yes, before a few words from our science, we hosted her. Yes, and she made indeed a wonderful short-term scientific mission in Malaga. And as I always say, she came from the snow because she came and flight just when she was stuck in Madrid with the biggest snow ever known in Spain. But
with
she
Filomena.
was really, with Filomena, really. She was really brave indeed, because she also came when we were going through the worst of the COVID-19 pandemic here in Malaga. But she just from the beginning was very, very enthusiastic and committed to the work. As you said, she is a physician doing the training in clinical pharmacology under the guidance of Professor Maculaitis, who is very much engaged with the European Medicine Agency, and also is the director of the clinical pharmacology unit in the Lithuanian University of Health Sciences in Kaunas clinics. But also under the close supervision of Simone Stakiewicz. To those surnames are really very difficult to pronounce. I just want to tell you that we were really impressed by her capacity to understand many clinical aspects of DILI, which in some way comes natural as she is a physician and involved in clinical pharmacology with all aspects of adverse drug reaction. She did a very thoughtful and really thorough analysis of the performance of the new revised causality assessment method. She showed great enthusiastic commitment, energy, and always with a frank and open smile, as you may see now. And we really miss her, but we still are collaborating very much and very close work with her. So we are really very excited to learn what you have to say, Lauryna.
Okay, thank you very much, Javier, and thank you very much, Maribel. It is very nice to see you all here today. I'm going to talk about my experience during a short-term scientific mission. Since you already have introduced me, I would like to introduce my team in Lithuania. I'm clinical pharmacology resident. I led the specialty, but it is quite a new specialty in Lithuania. It was established only in 2014, and only 7 clinical pharmacologists, only 7 physicians have graduated this residency program since then. And they work at 4 different hospitals in Lithuania. Also, there is 3 residents at this time, and we are mainly working at Lithuanian University of Health Sciences Hospital Kaunas clinicos. Our everyday work includes consultations on basically any drug-related questions, including suspected adverse drug reactions and sometimes suspected DILI. So this is
Go.
So this is how I first met with DILI. We had a patient at the hospital, and we were asked to consult on the probability of drug if it might cause liver injury or not. And since then, this field seemed very interesting for me. And my colleague Simona, who is a cost action group 5 leader, she was very supportive for me to apply for a short-term scientific mission. Yes, as Maribel already said, I had my short-term scientific mission last winter during January and February. Times were tough, and I still don't know if going on a short-term scientific mission at that time was the right decision. For me personally, it was a great experience. I am very grateful and very happy that I did it. I learned a lot of things, but from the ethical perspective, well, the COVID situation was really bad. Numbers of new cases were increasing rapidly in Lithuania and also in Spain. The vaccination process was just started, and there was many restrictions to travel. There was recommendations not to travel unless there is an absolute necessity. But after all this time, I think that we learned a lot of things, and that maybe showed us that if we follow the strict rules, it is possible and it is safe. So finally, I came to Madrid and had an overnight stay until my train to Malaga. While I was sleeping, Storm Filomena hit Madrid hard and covered it all in snow. All trains, buses, flights were cancelled, and even all streets were impassable. But people on the streets seem really happy and were enjoying snow. So finally, after 3 days in Madrid, I finally came to Malaga and met my coordinator, Professor Maria Isabel Lucena, and her wonderful team. During the stay, I had the ability to work on many different things and gain experience in a variety of experiences. I started with clinical DILI cases and DILI network activities. Then I was involved in RECAM analysis, and finally we started a new study about DRESS and DILI. So at first we were evaluating new DILI cases, evaluating the probability of the drug to cause the liver injury, and preparing those cases for international adjudication meetings. I have learned a lot from this, and I actually understood how important is the overall experience and overall understanding of this thing and in this field. When I came back to Lithuania just a few days later, we were very lucky to have a very interesting DILI case where a doctor suspected atorvastatin-induced liver injury, but it didn't really seem like a typical atorvastatin-induced liver injury. So we were looking for another drugs and find out that the patient was recently treated for bacterial pneumonia in a different hospital. She was treated with amoxicillin clavulanate, and this drug seemed more likely to be the culprit drug in this situation. And I just took the opportunity to present this case to my colleagues in the same way as we did it in Spain. And we had a small discussion on the final decision. It was just like a small local adjudication meeting. The next activity allowed me to a better understanding of principles of causality assessment. We were working with the new tool, RECAM, which is revised electronic causality assessment method. And we were looking at the definite DILI cases that were already adjudicated as DILI, and analyzing the differences between RUCAM and RECAM scores. There were some cases where those scores were quite different. So we reevaluated the impact of each question on the final score, and had a very nice discussion, and proceeded and proposed to include more information about liver biopsy, about associated suspected drug with likely time to onset of the reaction, and also made some suggestions on how to make this tool more user-friendly. During my stay, we also started a new study where we tried to look at the DILI and DRESS cases. The identified problems were the high incidence of DILI cases in DRESS syndrome, different existing liver injury criteria in DRESS cases, and also lack of DILI characterization in DRESS syndrome. We analyzed the Spanish and Latin American databases and divided all cases into 3 groups, which is DRESS cases, DILI with hypersensitivity features. Those were DILI cases with at least one of the following features, such as fever, rash, arthralgia, or eosinophilia or lymphopenia. And also the third group was DILI without hypersensitivity features. We made a comparison on demographics, clinical characteristics, laboratory parameters, and outcomes between DRESS and DILI cases with and without hypersensitivity features. Also made a table of most frequent culprit drugs and analyzed various characteristics of DRESS cases related to culprit drugs. Also compared our data with other existing data from other registries, and find out that DRESS patients were younger than patients with DILI with or without hypersensitivity features. Also, we found that DILI patients with hypersensitivity features had shortest duration of drug use compared to DILI without hypersensitivity features. The predominant liver damage was hepatocellular in all groups, but frequency varied between groups. These numbers were different in other registries, but it could be explained by differences of most culprit drugs in different countries, also the differences of genotype, for example, HLA in different populations. Also, we found that over half of the patients in all 3 groups showed moderate severity, but severe injury was more prevalent in DRESS cases. And most common culprit drugs were different in the groups. Here we can see the most frequent drugs that were involved in DRESS syndrome, DILI with hypersensitivity and DILI without hypersensitivity. As you can see, amoxicillin clavulanate was the most common culprit drug in all groups, but also we can see some important differences. To sum up, liver injury is really common in DRESS cases, and it has similar characteristics as DILI with hypersensitivity features or DILI without hypersensitivity features, but it also have some important differences. Moreover, we need to harmonize the criteria for liver injury in DRESS cases so we could compare it with other DILI cases more accurately. Also, it is very important to have a complete information about skin rash, so we could characterize the groups of DRESS and DILI with hypersensitivity features more precisely. And of course, some drugs are more likely to cause a specific reaction. Before my short-term scientific mission, we were planning a combined clinical and laboratory practice. We had to work with patient derived skin cells and its reprogramming to hepatocyte-like cells, and to look for new biomarkers and pathophysiology of DILI. But due to COVID, we were not able to start this interesting work. So is the bridge between Kaunas and Malaga functioning? I would say yes, definitely. After all this time, after more than a half year, we are still working on the publication of this very interesting work. We also keep in touch on the COST meeting that is planning in Lithuania in spring. Of course, if the COVID situation would get better, maybe we could keep collaborating on the laboratory work. And after all this experience, my dream is to have this registry, the registry in Lithuania. This is my last slide. I really enjoyed my short-term scientific mission. I would like to thank everyone, Maribel, and also all the team. It was a brilliant experience, and I hope that this presentation maybe motivates somebody to take the short-term scientific mission also.
Thank you very much, Lauryna. Very, very nice presentation. And particularly, it's very interesting to see that you are so motivated to set up a registry, DILI registry in Lithuania. I have seen that the first case that you went through when you came back, it was really challenging cases, because if you wouldn't have been there, it might have been attributed to atorvastatin, while it was amoxiclavulanate, previous drug, not the last one administered.
Yes, it was really a very interesting case, because a physician suspected atorvastatin, but when we looked at the whole situation, at the liver markers and everything, time to onset, it looked that maybe it's not atorvastatin. Maybe we could keep looking for another drug. And we were looking for the whole history, medical history, and it was quite hard because the patient were treated in another hospital previously. So we have to find those data, the treatment the patient got. And it was actually more interesting because the patient was treated with amoxicillin clavulanate, but then there was a rash. A patient got a rash from this treatment, and then the treatment was changed, and then after some time the liver enzyme increased, and we didn't find another reason, so we suspected it as drug-induced liver injury. And yes, but we haven't seen the rash, and we have a very limited information about laboratory results, but I think that there was a possibility that the patient had maybe DRESS syndrome. So it was a really interesting case.
So it also, I think, brings the idea that you have eyes to see what you know or what you think about. Otherwise, it would have gone maybe not meaning much to you or to any other member of the team. Also, in the benefit of the patient, this patient have a clear diagnosis, which is very important, so that they do not get exposed to the same agent, with the possibility of having a very much more severe presentation next time. No? So that's very interesting. Is there any question? Javier, are you over there? Oleg, hello.
I will take over. Javier asked for help because probably he has some problems with connection. If someone has questions, please do not hesitate. Let's start up discussion.
I think, sorry to continue, but as you have shared with us also a case of hepatitis after COVID vaccination, I think that these short-term scientific missions establish links of collaboration. And when a problem arises, then you connect with us and say, well, in that case was Simona, have you seen anything similar to this? And we said, yes, we are about to publish a clinical case presentation of an acute hepatitis after COVID vaccination, COVID-19 vaccination. So that goes on to say, how can we characterize this new clinical entity? And then it goes on to further or higher step in which there is a group that is collecting all these cases in order to make a centralized analysis of liver biopsy and biochemical data. So in that regard, I think science floats very nicely. The benefit is reciprocal, and at the same time, which is the most important thing, is the patient who really benefits of these scientific collaborations. What do you think?
I think those cases are very rare, so it is very important to keep in touch and to share the experience on this. I tried to count how many consultations did we have regarding Billy. Well, it wasn't very accurate, but I counted around 15 from 2019. I'm not sure if it's much or not. I think not, but yeah, it's important to find those cases, to you know, to recognize that it might be drug-induced, and yeah, and sharing experiences is very important.
I think that considering that you are a 2 million population.
Yeah, about 2.5.
2.5 is quite a big number, isn't it? 15, no, consultations. Yes, so that you are a reference already. The hospital, yes. Very nice, very nice. So I give the word to others.
Does anyone have a question or comment?
Well, just to say that it was an excellent talk, Lauryna. Thanks for giving us this talk. It was very impressive to see Madrid with all this snow. I didn't remember how much snow we had in January. And of course, we will be very happy to visit you in Kaunas very soon.
That's true. Could you tell us a little bit more about the next Kaunas meeting?
I don't know. Maybe it should be a surprise. No, we already did the program and counted the budget, and now we are working on you know, the place, food and everything. So I hope that everything will went well, and there won't be any restrictions with the COVID, so we could meet in person.
Yes, for sure. You know that in Kaunas, it was agreed at the end to have a meeting for the design of a clinical trial in drug-induced liver injury with ECRIN and SCREN, the platforms of clinical research networks, the European Clinical Research Network, ECRIN, and the Spanish, so that we could debate the pros and cons of this clinical trial in order to anticipate of the problems that we might face conducting a clinical trial on a rare disorder. So I think that is going to be very motivating, no? To go to Kaunas, apart from the excellent organization that you have already told us, because of this encounter, no? Because we are aiming for those that you could not, but I think most of you follow the management committee, or we will be presenting a grant, an European grant, so that will be perfect to be able to design a proper powered clinical trial. And you got much to say about that. And because maculitis also is very much connected with EMA, I think is the topic is perfect for this Kaunas meeting. Yes. Yes, we need the help of all of you. Eh? We count on all of you.
Yes, we need.
And Ismael, would you like to talk or to complement any aspect of the issue, the DRESS study, or Judith? Or maybe Marina?
Hi, I think Ismail is in a training course, so he's connected, but maybe he cannot talk. Oh, hello, everybody. Lauryna, for my part, sorry, because I couldn't help you with laboratory tasks because of COVID. I hope we can collaborate in the future. I hope so. And when we're working on the manuscript, we're collaborating with Lauryna and Judith, Ismael, Inma, and now we are finishing little aspects about the discussion, which is the most complicated part of all the manuscript. But I think we are going to finish it very soon, and we are so happy that I think we have collaborated very, very well between all of us, and yeah, I think it will be published successfully, I hope.
And I would say,
yeah.
Fernando Besones, from the leader of the Latin American Billy Network, is also with us. Fernando.
You can hear me?
Yes, perfect.
It was a very nice talk. Congratulations, Lauryna. It was a very nice talk. Very nice work. I have a question. Did you analyze how the features of characteristics of the rash was in this group of the study?
The characteristics of the rash, right?
Yeah.
Yeah, we
the step of the evolution of the rash is maybe different in some patients, you know?
Yes, it was different. Well, we took the cases from both Latin American and the Spanish databases, and take a look at the rash type, at the you know, how many body does it cover, the rash? What was the type? Is it maculopapular? Is it I don't know, like pustular or any other type of the rash? Yes, we take a look at it, but actually, since it's a Delhi registry, quite a lot of cases had information that the patient had rash, but it was not specified what kind of rash does the patient has. So it is very important for the future, I think, if the cases will be added to the registry, it is very important to specify what is the kind of the rash.
Yes, thank you. Thank you.
Yes, that's a big limitation because hepatologists focus on the liver, while dermatologists may focus on the rash. And the rash is not that important, but there is no information regarding the evolution of the rash, and if that evolution is in parallel to how the liver progressed. So it's a pity. That's certainly a limitation that we also highlighted in one review. They need to collaborate with dermatologists together for these stress cases in order to understand better the pathophysiology and the evolution of those cases.
And the behavior, okay.
Yes.
Okay.
Yes. Certainly it is.